People are slowly. Hello and welcome again to another Move with a Doc. I'm Dr. Rupa Shah, board certified family physician and obesity medicine specialist. And today we're going to talk a little bit about cholesterol. So as you know from previous Move with the Docs, just feel free to kind of do some stretching or moving, maybe get some fresh air while you're listening to this today. And just get a little bit of movement into your days. We're going to talk a little bit about cholesterol, what it is, what your numbers mean, and sort of the questions you should be asking to your physician when you go in. And a good time to kind of discuss your cholesterol or lipid panel numbers is during your complete physical exam, that once a year, yearly annual exam that you do with your physician. So let's just start with real basics. What is cholesterol? Today's talk is going to be just a little bit brief. I'm going to leave some time at the end too for folks if they have questions, but what is cholesterol? So cholesterol is basically a type of fat, okay? We can call this lipid, but it is a fat that's kind of circulating in your body, in your bloodstream. So we can call this many different things, just like at the real basic level, we can call it a lipid panel, a cholesterol panel, a fasting lipid panel. It's basically all the same thing. It gives you kind of a list of kind of the critical key numbers of what your cholesterol is. So it is important to realize that we need a healthy amount of lipid in our bodies, or fat in our bodies for some of those important body functions, okay? It protects our nerve sheaths, it helps in brain function. So again, so important in kiddos to get these essential fatty acids. But as we get older, having too much of these fats in our bloodstream can lead to heart disease, otherwise known as coronary artery disease, CAD. And what is heart disease? When we talk about heart disease, sometimes people don't realize, like, what is heart disease? Basically, what happens is the lipid accumulates, okay? It collects in your blood vessels of your heart. We can call these our coronary arteries, okay? The vessels that are on, like, supplying blood supply to the heart. And then when it accumulates on the interior of these blood vessels, it causes a blockage to the flow, okay? And that's sort of the key, is this, this accumulation causes a blockage, but it also causes inflammation, okay? And when you have both of those things, when you have both a blockage where it's kind of layered on the interior of the vessel, and you have inflammation, this is when a little piece of that lipid can fling off, break off, and then lodge itself downstream in one of your heart vessels. And what is this? This is a heart attack. What will you experience? You'll have chest pain, chest pressure, shortness of breath. And the longer that blood flow is restricted, the more symptoms that you're going to have, the more damage to the heart is going to occur, and you're going to get what we call ischemia, or death of that myocardium of the heart muscle. Okay, so again, chest pain, tightness, shortness of breath, a heaviness, an elephant sitting on your chest, maybe some left arm pain, maybe some pain radiating up into your jaw, your neck, a tightness. So that's why it's really important to recognize those symptoms. But it's also important to recognize that you can get accumulation of this lipid, not just in your coronary or your heart vessels, but also in your extremities. Okay, we have blood vessels going to our legs. This is called, to really simplify it, peripheral artery disease. Okay, so this is restricted blood flow in your legs. What does this present as? You're starting to walk and you're feeling like you're getting cramps in your legs, because again, you're not getting enough blood flow down there. So if you walk, you feel like you get some crampy achiness in your legs, you stop walking, the pain gets better, then you start walking again and you get the recurrent symptoms. That could be a symptom of peripheral artery disease, and you do need to see your physician about that. And then lastly, you can also get accumulation of that plaquing or the cholesterol in your carotids. You have carotid artery on the left and the right side of your neck. What does this lead to if you get a blockage there, or if a piece of that kind of cholesterol plaque breaks off and goes to your brain? Well, that's an kind of simplistic terms, a brain attack or a stroke, okay, an ischemic stroke. So again, sequelae of high cholesterol can be peripheral artery disease, coronary artery disease, or stroke, okay? So just to give you a little kind of background on why it's important and why we're always talking about what are your cholesterol numbers and heart disease, and we throw around all these terms, but that's really the reason, okay, because we want to prevent coronary disease. So what does a lipid panel tell you actually? And if you know your numbers, or if you've got it on your MyChart, you can bring them up right now and just kind of look at them as we're talking. But the total cholesterol is obviously the total amount of cholesterol that's circulating in your blood. And there is a formula for calculating it. You can take your HDL plus your LDL plus 20% of your triglycerides, and that should give you your total cholesterol. That's always going to be listed on your kind of your lab report, okay? The next one that you probably see is the HDL level, okay? So this stands for high density lipoprotein. This is commonly referred to as the good cholesterol, okay? This is what kind of moves the cholesterol, the extra cholesterol from your bloodstream to your liver. And then your liver can sort of try to get rid of some of this from your body. So when you see HDL, just you can think of it as H for helpful or good cholesterol. And HDLs can really help your arteries clear some of the cholesterol that your body doesn't need. And it's the one number and the only number really that you want to be elevated or high in your lipid panel. Okay, so that's the only one that should be high. LDL. This is the bad one. This is the low density, okay? So low density just means small, kind of very dense particles that can lead to heart disease. It's the bad cholesterol, so commonly referred to as that does contribute to most of the plaque buildup in your coronary arteries. Now, again, you need some LDL because they do carry cholesterol to your body cells. And again, your cells need some of this fat to do some of their daily functions. But having too much of this really is what can cause a problem, okay? The VLDL is the very low density lipoprotein. It's really just another bad form of cholesterol that you really don't want. It does contribute to plaquing. They carry a type of fat, mostly triglycerides in your blood. So if you have too many VLDLs, the extra fat can also build up in your arteries. Triglycerides is another type of fat. Again, you need some triglycerides, but excess levels does put you at risk for atherosclerosis, heart disease, and that such sort of thing. So having too many triglycerides, or what we call hypertriglyceridemia, is also not what we want, okay? Sometimes you'll see on your panel too, the ratio between your total and HDL. This is just the total cholesterol divided by your HDL. In general, you kind of want that number below 5. But really what I focus mostly on when I'm talking to patients is what is your LDL, your HDL, and your triglyceride numbers doing, okay? So what kind of numbers do we want? Total cholesterol, we want generally less than 200. This is ideal, okay? Triglycerides, the numbers have changed over the years. Previously, we wanted it less than 200. Now, really, the goal is less than 150, okay? HDL, remember the good cholesterol, the helpful cholesterol, is different in men and women. In men, we want that number above 40, and in women, above 50 is our goal, okay? So remember, that's the only one that we want elevated. And LDL, we strive for about less than 120. That is ideal. There are certain health conditions, though, that if you have, we need it less than 100. And those are diabetes and chronic kidney disease, or CKD. So if you have any type of renal disease that you've been diagnosed with, or diabetes, type 1 or type 2, you want the LDL less than 100 because we know the risk of heart disease already goes up higher with some of those disease processes. Couple just notes, when you get your cholesterol panel, your lipid panel drawn in the lab, I do think it's really important to make sure you have been fasting the day that you have it done. So typically a 10 to 12 hour fast is ideal. You can have water in the morning, you can have black coffee, but really avoiding any other food, anything to eat the morning of. And I'll even go so far as to say the night before, try not to have like a giant piece of cheesecake or a giant steak or anything that might just make it a little tougher for your body to clear out some of those fats in the early morning. So How often should you have your cholesterol checked? It depends. If you have high cholesterol, we advocate every year just to keep an eye on it, but generally every 1 to 2 years, depending on your age. Current guidelines say that we should start about age 16 in the pediatric population, actually, because there are some familial hyperlipidemia processes, so we can pick up those kiddos early. Other than that, if you don't have that, you can kind of restart checking it in your late 20s, 30s, just to see kind of where you're at, okay? And again, you'll need it checked more often if you're on any medication for that, if you have diabetes, chronic kidney disease, or other, or if you have a known history of heart disease, you'll need to have it checked more often. So let's say you get your cholesterol checked and you kind of get the message that your cholesterol is elevated. So what are you going to do at this point? Well, number one, focusing on diet and exercise, kind of the most common sense thing to do. You want to eat a diet that's high in fiber, okay? We focused a lot in the past on don't eat too many fats and saturated fats. So that does hold true. You don't want to eat a diet high in saturated fats and high in animal fat, so you don't want to eat a lot of red meat. Those will raise your triglycerides and your LDL. But we have to remember that fried, greasy foods can also raise our triglycerides. And we now know that if you eat a diet that's really high in carbohydrates and sugars, this will contribute to high triglycerides and high LDL levels too. So really, it's not all about fats always. It's about just an overall healthy diet where you're limiting the intake of simple carbs, sugars, and animal fats, okay? You want to try to maintain a healthy weight. This can also go a long way in maintaining normal cholesterol levels. And then focusing on a healthy diet. I particularly do like the Mediterranean diet. It's got advocates, the good fats through olive oil, low carbs, and low animal fats. If you have a low HDL, remember that's the level that you want to be elevated, okay? And it is hard to raise your HDL, but you can focus on those omega-3 fatty acids. So that means eating more fatty fish that has that. You can take a supplement. You can take an omega-3 supplement to help raise your HDL levels as well. You can try and incorporate nuts, things like walnuts, almonds. Remember, small handfuls of those because nuts are also high in a lot of fats, but a small handful can really benefit your HDL. We also know that exercise is a powerful promoter of HDL as well. So that might be something else to consider if your numbers show that you have a really low HDL. That the HDL does tend to be one of those numbers that for some reason, or for some people can actually be pretty genetically linked, and that can just be low. But there, like I said, there are things that you can do by focusing on omega-3s, exercise, nuts, foods high in omega-3s that can help raise that HDL too. In terms of exercise, you want to aim for about 150 minutes of aerobic exercise every week and incorporate 2 days of muscle strength training. So those are kind of the current recommendations for exercise. I want to say one thing here as you're maybe looking at your cholesterol numbers as we're talking, because this happens to me every now and then where we get somebody who is doing all the right things. They have a normal weight, they're exercising, they don't eat a lot of carbs, they don't eat a lot of fat, they're vegetarian, or they eat a really plant, forward diet, and they still have very high LDL or very high triglycerides. There are some familial forms of hyperlipidemia, or meaning high cholesterol, where people can have just an isolated, extremely elevated triglycerides, like above 300 or above 400, or really extremely high HDL levels above 200, 250. And some of these can be genetic. So I just mention that because not all of this is within our individual control. And if you happen to be one of those folks that has that, you may just need to talk to your physician about medication to help lower the cholesterol. So a question that I get asked pretty often is, when do I need to start taking cholesterol lowering medication? Because you may be looking at your numbers thinking, seeing them in like maybe your cholesterol is 240, your LDL is like 160, triglycerides are 190, when does someone start taking a cholesterol lowering medication? And should you even take a cholesterol lowering medication? Always a lot of controversy in the media about this too. So the answer is it really varies, of course, right? You have to discuss this with your physician because there's a lot of factors that go into it, okay? Your age, your other chronic medical issues, your family history, and it really is kind of what we call a shared decision-making with your physician. You really want to talk this over with them. But we do have an ACC risk calculator. A bunch of cardiologists came together and tried to come up with some factors and a little calculator that could help decide on risk. So the risk calculator, we plug in a couple of values, different values, your age, whether or not you smoke, whether or not you have diabetes or not, hypertension, your LDL numbers, and your race. And it will calculate a risk score for you. And what that risk score means is that what is your risk of having a coronary event, a heart attack or a stroke in the next 10 years? And the consensus was that any risk score above 7.5, okay? Any risk score above 7.5%, those patients should strongly consider taking a cholesterol lowering medication called a statin medication, okay? Again, it's shared decision making. So you doesn't mean if your score is 7.6%, you have to take it, but you have to have that conversation with your physician to see if it makes sense for you. Remember, if you have diabetes, chronic kidney disease, you're kind of opted out of the risk calculator. You want that LDL below 100. It's really important to have the lowest possible LDL that you can to keep your risk of having a coronary event low. And when we say low for LDL for diabetes and chronic kidney disease, we're talking about 70 to 80 is kind of the number you want to see, okay? Also, another carve out, if your LDL number is greater than 190, remember earlier I just talked about familial forms, or if your LDL just happens to be above 190, we do not calculate a risk calculator on you, or a risk score on you, rather. You are urged to take a statin medication in that case because the LDL is felt to be so high. So again, those are kind of some of the carve-outs. Some chronic diseases where we want the LDL really low, and some cases if the LDL is really high, you should be taking a statin, okay? So we've talked a little bit about what the cholesterol panel tells you, what kinds of medical issues it can lead to, what the target goals are, and things that you might be able to do to lower your cholesterol. As you might be listening, one thing that may have come up for you is you're thinking, well, how do I know if I have plaque buildup in my coronary arteries? Is there a way that I could find out? And the answer is yes, there is actually. And it might not be one that your physician talks about often because it's not routine screening, but there is a test called a coronary calcium scan. Okay, I'll say it again, a coronary calcium scan, or it's otherwise referred to as a coronary CT. So basically it's a CT scan. So it provides images of your coronary arteries and it will show where you have existing calcium deposits, okay? And these are called those calcifications. And again, those deposits or those calcifications are an early sign of heart disease, of coronary artery disease. So you'll get pictures of your heart taken while you lie in a scanner for about 10 minutes or so. It's simple, it's painless, and again, it's called a computed tomography, a CT scan. There is a bit of radiation, however, and basically a score of 0. Okay, so if you get a score of 0, has really been shown to indicate that you have a very low risk of having a heart attack within the next 10 years. So for somebody who has a lot of risk factors for heart disease, let's say you've smoked for many years, you've had high blood pressure for many years, you have elevated cholesterol, this can be a really interesting scan to have done, and then really determine how aggressive you want to be with your treatment. So again, remember we talked about the ACC risk score. Maybe you've got a risk score and you're not sure, what you should do with that risk score. Obviously, if the risk score is really low, a CT scan is probably not indicated. But if your risk score is elevated, you might want to consider getting a coronary CT. So it can kind of help in certain situations. And again, a coronary CT can help to see when you might want to start treatment and see where your risk is, whether you're high risk or low risk for having a coronary event. Okay. I will say the test is relatively new. It's not part of our standard guidelines. This is why your physician is not going to always bring this up. And again, not all insurance plans cover it. So that's a key also. They're pretty inexpensive out of pocket. But again, not all insurance companies will cover it. So again, not standard of care, but I wanted to just make you aware that this type of testing does exist. And so you could talk to your physician about it and see if that might be something you might want to pursue. Okay. So that's kind of all I have today on the topic. But again, I think it's really important that you know your numbers. Make sure that at your next physical, if you don't know your numbers, that you request to have that lipid panel completed. Make sure you're fasting when you get it done, and just be aware of those numbers. If nothing else, if it's elevated, it's just a good indicator that you need to start working on lifestyle modification, good diet, good exercise, and just taking an overall better look at your health. So that's all I have today. And thank you again for joining in.